I'm going to share with you 5 solid insider tips of how you can successfully obtain a clinical fellowship in Canada with zero prior Canadian experience. Let's do this together. Hi there, if you're new here, I'm Dr. Rajiv Iyer. I'm a practicing physician in the USA. I used to work in Canada before and I did have Canadian permanent residency as well. I come with the experience of guiding hundreds of international medical graduates like you. Insider tip number 1 is, when you focus on applying for a clinical fellowship in Canada, focus on what your background is. In other words, you want to apply for a fellowship in which you already have some experience and expertise in, of course. Is that not the reason why you want to do a clinical fellowship in Canada, to build that? It is. But the programs are actually assessing if you come with some baseline experience, and they tend to prefer those types of candidates more than people with no experience. Now, I'll take the example of one of our most recent candidates who successfully obtained a clinical fellowship in University of Ottawa. Now, she's a radiologist, comes with some experience in the particular field of radiology this person is applying to, and the program assesses her application. She gets called for an interview. She does great in her interview and then receives an offer letter that she's been offered a clinical fellowship. Now, this is the way you want to establish your experience as you're applying for these clinical fellowships. Are you someone who is interested in doing a clinical fellowship in Canada? Just comment a simple yes or no below. Now, the next step is to prepare a strong application, which consists of your CV and your cover letter or a personal statement. The CV has to read according to what the Canadian style is. If you do not know how to do this, we are here to help you out, but that's basically what the program is expecting. What is required is a high level of clarity in the CV and how it's organized, how it's formatted, everything. Because you don't want to confuse the program director and the people reading your CV, but rather be very clear on what you are, what your background is, where you're coming from, etc. As you're preparing for the personal statement or the cover letter, make sure you include all the values and all the things you bring into the fellowship, and how this is going to help you solidify your career as well. Now, if they don't specify any page limit, we generally recommend making a 2-page cover letter. If it's a personal statement, it's okay to stick to 1. But bottom line, what you put in is more important than the length of these documents. On to tip number 3. There are only 17 universities in Canada, out of which 3 in the Quebec province are heavily focused on French. Now, we had another candidate who successfully obtained a clinical fellowship in the University of Montreal. The expectation is that the university requires a lot of documents and proficiency in French language. Now, thankfully, this IMG doctor was really good at both spoken and written French, which actually helped him obtain a clinical fellowship in Montreal. But this is the way you want to think about. But if you're not someone who's good at French, then you're left with 14 English-speaking universities. When you submit your application, you may want to maximize your chances depending on your background and experience. But hang on, before you actually do this, make sure you do a really nice job, because once you submit the application, you get rejected or you don't hear back, the chances of you going back are going to be very, very slim. So if you decide to need our help, so do seek out our help much early on, even before you try any of this, and experiment yourself and crash the chances, because it is really difficult to resuscitate a dead application, but rather it's always better to go with a very high quality application right from the get-go. Hopefully you're getting the message. This part is really key because the hospitals do not know who you are as a candidate. So they get a mental picture of you by reading your CV and your cover letter or your personal statement, and this is how they make a decision to call you for an interview, even though they do not know who you are. So they're taking a chance. You need to prove them that you're an excellent candidate by demonstrating high quality documents and the way you approach them. Making sense? The 4th tip is about the letter of recommendations. Now, this has been a topic of huge confusion, because if you are someone applying for clinical fellowships from your home country, the biggest question people ask is, I do not have any Canadian letters of recommendation. What am I going to do? That is completely fine. That's the whole idea of applying for a clinical fellowship. In fact, it's the same concept in the US as well. because you're applying from your home country, so you cannot have any letter of recommendations from these countries. So your letter of recommendations does actually come from your home country, and that is completely acceptable. And in those letters, your referees would very clearly mention about all your abilities, your clinical skills, communication skills, and many other things. So they look a high quality letter of recommendation. So you do not need Canadian letter of recommendations, okay? But there are exceptions. If you're already in Canada doing an observership, then you can use your Canadian LOR, assuming they are willing to give you, but many times it works in some candidates' favor, but it also can be risky for other candidates if you do an observership. So it really depends on how comfortable you are taking all these risks. The last thing is about permanent residency. Many folks actually apply for permanent residency from their home countries, move to Canada, or in the process of moving to Canada, and then think of applying for a clinical fellowship. We actually encourage you to do exactly the opposite, which means you try to find a position in Canada as a clinical fellow and then use that experience to apply for permanent residency. There is one exception here. If you want to do residency in Canada, you do not have a choice. You must be a Canadian permanent resident or a Canadian citizen, at least at this stage. But for clinical fellowships, you do not need to have any particular Canadian status, and rather we encourage you actually go without any Canadian status and rather apply based on your experience, your background, and why you want to do this fellowship rather than being a permanent resident. And this is exactly how I got my Canadian permanent residency, using my clinical experience in Canada, and I was able to successfully obtain this within a span of few months, even without using any immigration consultants. I did everything on my own. Of course, I did mess up something, and I have made a video exactly as to what is a mistake you should not be doing while you're considering to apply for a Canadian permanent residency application. I encourage you to check this out. If you do need our assistance with anything, you can always go to our website, www.imgsecrets.com. Book an appointment from there, either with me or one of our experts. We will be more than happy to guide you with all these next steps and ensure to create a stellar application for you and provide guidance through the process. Take care, stay safe. I'll talk to you soon. Let's say you're a cardiologist and you have experience in, for example, let's say you're a nephrologist and you have, if you have someone whom you can trust who is already in Canada and is willing to